Assalamu alaikum students. Today's topic of discussion is colorectal carcinoma. Now, before starting the colorectal carcinoma topic, I would like to mention few topics that are actually disorders that are familial adenomatous polyposis and hereditary non-polyposis colorectal carcinoma. Okay. Now, you must be familiar with the term that is adenomas. What are adenomas? Are actually the glandular tumors with the glandular origin or glandular-like characteristics. It is not necessary that the origin is always from the glandular epithelium. There may be origin from the tissues that have glandular-like characteristics. Okay, these are actually adenomas. Now, what happens in familial adenomatous polyposis? These all are actually disorders of large bowel. Ascending colon, sigmoid, and all these structures are involved. And we are discussing the carcinomas and other disorders that can lead to the colorectal carcinomas. So let's just start. Familial adenomatous polyposis. What is this? You have to learn 3 to 4 features of this disorder. That is actually now one by one I'll discuss the features. That is, it is actually numerous adenomas in the teenage. Like a young patient presents with this disease, so there are numerous adenomas. Adenomas are actually tumors that are of glandular origin. Now, what is the pathology? Pathology is mutation in the APC gene, that is adenomatous polyposis coli gene. Okay, this mutation in this gene will lead to FAP. Now, for diagnosis, there must be 100 polyps in the patient. 100 is the diagnostic clue. You have to count, and if there are 100 polyps, it is 110% FAP. Now, if FAP is left untreated, it can lead to adenocarcinoma of the colon. It is a major risk factor for colorectal carcinoma. This is FAP. Now, what is the presentation is adenomas in the teenage, mutation and diagnostic value if left untreated, this, and the extraintestinal manifestations other than the large bowel, it is associated with Gardner syndrome and Turcot syndrome. Now, what are these is you must remember this mnemonic DOIT. Now, DOIT stands for desmoid tumors. Desmoid tumors are actually arising from the connective tissue. What is O? O is osteomas of mandible, epidermal cyst. Now, an encapsulated cyst or swelling or outgrowth is seen on the skin. T is supernumerary teeth, which means that there are lot of numbers of teeth. Okay, other is the association is the Turcot syndrome. Now, what is this? It is the intestinal adenomas per the CNS plus the CNS tumors, that is medulloblastoma. Now, if you are studying any CNS tumor, particularly medulloblastoma, you must be knowing the Turcot syndrome association, so that it will be easy for you to correlate. If a patient comes with a medulloblastoma, you must see or check the CT abdomen to see the intestinal adenomas. Okay. Now, there is also some patients lack the APC gene mutation and they have this MUTYH gene mutation. This is actually a repair gene. This is all about FAP, and it is a very important topic and very major risk factor for colorectal carcinoma. Now, come to the next topic, that is hereditary non-polyposis colorectal carcinoma cancer. Now, it is also called as Lynch syndrome. It is of two types, so 1 and 2. Okay, Lynch syndrome 1 and 2. Now, non-polyposis, as the word indicates, is actually there are adenomas, but there are not excessive number of polyps. So this is non-polyposis. Now, what is this? Is actually Lynch syndrome is only associated with colorectal carcinoma, and in type 2 there is cluster of cancers, which means